Welcome to the INHE Human Kinesiology Study Guide. This presentation has been designed to help you review the essential anatomy and kinesiology concepts covered throughout Module 2. As you progress through this guide, focus on understanding how bones, joints, muscles, and connective tissues work together to create movement. Remember that kinesiology is much more than memorizing structures. It is about understanding relationships. When you understand how the body functions as an integrated system, you will be better prepared not only for examinations, but also for your future work as a massage therapist. Let's begin by exploring the science of human movement itself. What is kinesiology? Kinesiology is the scientific study of human movement. Every movement we perform, whether walking, lifting, reaching, or turning our head, requires coordination between muscles, bones, joints, and the nervous system. As massage therapists, understanding movement helps us identify postural imbalances, movement restrictions, and potential causes of pain and dysfunction. Kinesiology examines movement from several perspectives. Anatomy provides the structures involved. Biomechanics explains how forces act upon those structures. Physiology helps us understand how muscles generate movement, while neuroscience coordinates the signals that control the entire process. When studying movement, you will often encounter the concepts of kinetics and kinematics. Kinetics examines the forces that create or resist movement, while kinematics describes the movement itself, including direction, speed, and range. Now that we understand the study of movement, let's examine the skeletal framework that makes movement possible. Major bones and classifications. The skeletal system serves as the body's framework, providing support, protection, and attachment points for muscles. The adult skeleton contains approximately 206 bones, each designed to perform specific functions. Long bones act as levers that allow movement. Short bones provide stability and support. Flat bones protect important organs and provide broad attachment surfaces for muscles. Irregular bones perform specialized functions throughout the body, while sesamoid bones improve leverage within tendons. As you study anatomy, notice how the shape of a bone often reflects its function. The femur is built for strength and weight-bearing, while the vertebrae are designed for support and protection of the spinal cord. Understanding bone classifications creates a strong foundation for identifying the landmarks that muscles and ligaments use as attachment sites. Next, let's examine those landmarks more closely. Bone landmarks. Bone landmarks are the surface features found throughout the skeleton. These landmarks serve as attachment points for muscles and ligaments or form important parts of joints. For massage therapists, these landmarks are valuable because many can be located through palpation. They help us orient ourselves when assessing posture, muscle tension, and movement patterns. Processes, tubercles, tuberosities, crests, and spines are examples of projections that provide attachment sites for soft tissues. Condyles, heads, and facets help form joints. Fossae and grooves create spaces for movement or passage of structures, while foramina allow nerves and blood vessels to pass through bone. As you continue your studies, you will encounter many of these landmarks repeatedly. Learning to identify them visually and through palpation will greatly improve your anatomical understanding. Now let's examine another important structure that contributes to stability throughout the body. We're ligaments. Ligaments are strong bands of connective tissue that connect bone to bone. Their primary function is to stabilize joints while guiding movement and preventing excessive motion that could result in injury. Unlike muscles, ligaments do not actively create movement. Instead, they act as passive stabilizers. They help maintain proper alignment and provide structural support throughout the body. Because ligaments contain a limited blood supply, healing after injury is often slow. This is why sprains can take weeks or months to fully recover. Many of the joints we will discuss later in this presentation rely heavily on ligaments for stability. Understanding their role will help explain many common musculoskeletal injuries. Before moving into specific regions of the body, let's examine how posture can reflect underlying muscular and structural imbalances. Common posture deviations. Posture provides valuable information about how the body is functioning. When posture becomes altered over time, certain muscles may become shortened and tight, while others become weak and lengthened. These imbalances can affect movement efficiency and contribute to pain and dysfunction. Common postural deviations include excessive thoracic curvature, excessive lumbar curvature, lateral spinal curvatures, forward head posture, and rounded shoulders. As future massage therapists, learning to recognize these patterns is an important assessment skill. Posture often reveals where abnormal stress is occurring and helps guide treatment planning. When evaluating posture, always think about the muscles that may be contributing to the observed alignment. Understanding posture naturally leads us to the study of how muscles work together to produce movement. Agonists versus antagonists. Movement rarely occurs through the action of a single muscle. Instead, muscles work together in coordinated groups. The agonist, often called the prime mover, is the muscle primarily responsible for creating a specific movement. The antagonist opposes or controls that movement, helping ensure smooth and coordinated motion. Synergists assist the agonist, while fixators stabilize structures so movement can occur efficiently. This teamwork between muscles allows the body to move with precision and control. Understanding these relationships is essential when studying movement, assessing dysfunction, and developing treatment strategies. Now that we have established the foundational principles of kinesiology, let's begin examining the muscles of the head, face, and neck that contribute to expression, mastication, and cervical movement. This is the end of Section 1. The next section: face, jaw, neck, skull, shoulder girdle, and shoulder joints. Section 2. Face, jaw, neck, skull, and shoulder complex. Facial muscles and functions. The muscles of the face are unique because many attach directly into the skin rather than moving bones across joints. These muscles allow us to communicate emotions, express ourselves, and perform many important daily functions. When you smile, frown, blink, or raise your eyebrows, facial muscles are responsible for those movements. In addition to muscles of facial expression, the face contains muscles involved in mastication or chewing. These muscles generate the forces needed to move the mandible during eating and speaking. As you study facial anatomy, pay attention to the relationship between muscle location and function. A muscle's position often provides clues about the movement it produces. Next, we'll take a closer look at the attachments of these muscles and the movements of the jaw joint. Facial attachments and jaw range. Understanding where muscles originate and insert helps explain how movement occurs. Facial expression muscles generally move the skin rather than a joint. In contrast, the muscles of mastication act on the temporomandibular joint, commonly known as the TMJ. The jaw is capable of opening, closing, protruding, retracting, and moving side to side. These movements are essential for speaking, chewing, and swallowing. As you review the muscles involved, think about how different combinations of muscle contractions create smooth and coordinated jaw movement. The TMJ is one of the most frequently used joints in the body, making it especially important for massage therapists to understand. Moving from the face, let's examine the muscles responsible for controlling head and neck movement. Neck muscles and functions. The neck contains a complex group of muscles responsible for supporting and moving the head. These muscles allow us to flex, extend, rotate, and laterally bend the cervical spine while maintaining stability and posture. Because the head is relatively heavy, the neck muscles must work continuously throughout the day to maintain alignment. Many clients experience neck tension related to posture, stress, repetitive activities, or prolonged computer use. Understanding cervical anatomy helps explain why these problems are so common. As you study these muscles, visualize how their attachment points determine the direction of movement they produce. Next, we'll look more closely at those attachment sites and the ranges of motion available within the cervical spine. Neck, attachments, and joint angles. The cervical spine is designed to provide both mobility and support. Its muscles attach to the skull, vertebrae, ribs, clavicle, and scapula, creating multiple movement possibilities. When studying cervical range of motion, consider how flexion, extension, lateral flexion, and rotation contribute to everyday activities. Notice that different muscles often work together to produce the same movement. This redundancy helps maintain function even when one structure becomes injured or restricted. Because many neck muscles also influence breathing, shoulder position, and head posture, dysfunction in one area can affect several regions simultaneously. Now that we've reviewed the muscles of the neck, let's examine some important bony landmarks of the skull. Skull bones and landmarks. The skull serves several important functions, including protecting the brain, supporting sensory organs, and providing attachment sites for muscles. Two particularly important bones for this course are the temporal bone and the sphenoid bone. These structures contain landmarks that are frequently referenced in anatomy, kinesiology, and clinical assessment. As you study the skull, focus not only on identifying the landmarks, but also on understanding why they are important. Many muscles attach to these structures, while others protect or support vital neurological and endocrine functions. The skull provides the foundation for many muscles of the head and neck, but movement of the upper extremity begins with another important structure, the shoulder girdle. Clavicle landmarks. The clavicle, commonly known as the collarbone, serves as a strut that positions the shoulder away from the trunk. This unique design helps maximize mobility of the upper extremity while also transmitting forces between the arm and the axial skeleton. Several important landmarks are found along the clavicle and serve as attachment sites for muscles and ligaments. When palpating the clavicle, notice how easily it can be felt beneath the skin. This makes it one of the most accessible bones in the body for assessment and anatomical orientation. The clavicle works closely with another important bone of the shoulder girdle, the scapula. Let's examine that structure next. Scapula landmarks. The scapula, or shoulder blade, serves as the foundation for many upper extremity muscles. Unlike many bones, the scapula is highly mobile and glides across the rib cage during movement. This mobility contributes significantly to shoulder function. As you study the scapula, pay particular attention to its borders, angles, processes, and fossae. These landmarks serve as attachment sites for muscles that stabilize and move the shoulder complex. Many muscles of the rotator cuff originate from the scapula, making this bone especially important when studying shoulder anatomy. The movement of the scapula is closely coordinated with the movement of the humerus and clavicle. Together, these structures form several important joints. Let's examine those joints next. The three shoulder joints. The shoulder complex is one of the most mobile regions of the human body. This mobility is possible because several joints work together rather than functioning independently. Each joint contributes a unique movement component, allowing the upper extremity to reach, lift, push, pull, and perform countless daily activities. As you study these joints, think about the balance between mobility and stability. The shoulder achieves remarkable range of motion, but that freedom comes at the cost of increased injury risk. Understanding how these joints interact is essential for assessing shoulder dysfunction and developing effective treatment approaches. Now, let's apply this anatomical knowledge to a clinical scenario. Clinical thinking, the joints. Imagine a client who falls directly onto the point of the shoulder and later reports pain near the top of the shoulder. As you evaluate this scenario, consider which structures may have absorbed the force of impact. Think about the joints involved, the bones that form those joints, and the ligaments that help provide stability. Consider which movements might reproduce pain and which landmarks would be most useful during palpation. Clinical reasoning begins with anatomy. The more familiar you become with these structures, the easier it becomes to identify possible causes of dysfunction. Having completed our review of the shoulder complex, we'll continue by examining the muscles that move and stabilize this highly mobile region. This is the end of Section 2. We will be moving to the next section: shoulder muscles, rotator cuff, scapular muscles, coracoid attachments, neurovascular entrapment, and arm muscles. Section 3. Shoulder muscles, rotator cuff, scapular muscles, and arm muscles. Shoulder muscles and functions. The shoulder is capable of more movement than any other joint in the body, and that mobility depends on a coordinated group of muscles working together. Some muscles create large, powerful movements, while others provide stability and control. As you study the shoulder muscles, focus on the actions they produce and how they contribute to functional movement. Think about everyday activities such as reaching overhead, lifting an object, pushing open a door, or pulling something toward you. Each of these actions requires multiple muscles to work together in a coordinated manner. Among all shoulder muscles, a small but critically important group deserves special attention: the rotator cuff. The rotator cuff sits. The rotator cuff is a group of 4 deep muscles that surround and stabilize the glenohumeral joint. While larger muscles create powerful movement, the rotator cuff acts like a dynamic stabilizing system. These muscles help maintain proper alignment of the humeral head within the shoulder socket during movement. Without the rotator cuff, the shoulder would be far less stable and far more vulnerable to injury. As you study these muscles, focus on their location around the scapula and the specific actions they perform. Rotator cuff injuries are among the most common shoulder conditions encountered in both athletic and non-athletic populations. Understanding their anatomy provides a foundation for recognizing common patterns of dysfunction and pain. Next, let's examine where these muscles attach and how they contribute to shoulder range of motion. Shoulder attachments and joint angles. The shoulder muscles attach to several structures, including the clavicle, scapula, humerus, sternum, ribs, vertebral column, and pelvis. Because of these extensive attachments, shoulder movement often involves coordinated actions throughout the upper body. As you review these muscles, think about how their origins and insertions determine the direction of pull and resulting movement. Notice that no single muscle performs all shoulder motions. Instead, multiple muscles contribute to abduction, flexion, extension, internal rotation, and external rotation. This coordination helps maintain both mobility and stability throughout the shoulder complex. While some muscles move the humerus, others focus primarily on controlling the position of the scapula. Let's examine those muscles next. Scapular muscles. The scapula serves as the foundation for upper extremity movement. Before the arm can move efficiently, the scapula must be properly positioned and stabilized. Several muscles are responsible for controlling scapular movement. Together, they produce elevation, depression, retraction, and protraction. As you study these movements, visualize how the shoulder blade moves across the rib cage. Proper scapular function is essential for healthy shoulder mechanics. When scapular movement becomes restricted or imbalanced, shoulder dysfunction often follows. Understanding scapular motion helps explain many common postural patterns and shoulder complaints encountered in clinical practice. Several important muscles also attach to a unique structure on the scapula known as the coracoid process. Let's explore that landmark next. Coracoid process attachments. The coracoid process is a small but important projection located on the anterior aspect of the scapula. Despite its size, it serves as an attachment site for multiple muscles and ligaments that contribute to shoulder stability and movement. As you study this region, pay attention to which muscles attach here and which do not. Understanding these relationships helps clarify the anatomy of the shoulder girdle and upper extremity. The coracoid process is also an important landmark during palpation and clinical assessment. Knowledge of attachment sites allows therapists to better understand movement patterns, muscle actions, and potential sources of pain. Moving deeper into the shoulder region, let's examine an important clinical condition involving nerves and blood vessels. Neurovascular entrapment. The shoulder and neck region contains important nerves and blood vessels that travel from the trunk into the upper extremity. In certain situations, these structures may become compressed as they pass through narrow anatomical spaces. When compression occurs, clients may experience symptoms such as numbness, tingling, weakness, pain, or changes in circulation. As you study this topic, think about how muscle tension, poor posture, or repetitive movement might contribute to compression of these structures. Understanding neurovascular entrapment helps explain why some symptoms extend beyond the site of the original problem. A client may report symptoms in the hand or arm even though the source of compression originates near the neck or shoulder. Next, let's move down the upper extremity and examine the muscles responsible for elbow movement. Arm muscles. The muscles of the arm work together to flex, extend, and stabilize the elbow joint while also contributing to movements of the forearm. These muscles play a major role in daily activities such as lifting, carrying, pulling, pushing, and reaching. As you study these muscles, pay attention to where they attach and the movements they create. Notice how some muscles cross multiple joints and therefore contribute to more than one action. The elbow may appear simple compared to the shoulder, but efficient movement still requires precise coordination between flexors, extensors, stabilizers, and forearm muscles. Understanding these relationships is essential for assessing upper extremity function and identifying common movement restrictions. Having completed our review of the upper extremity, we'll now move to the central support structure of the body, the vertebral column, and the muscles that stabilize it. This is the end of Section 3. The next section include vertebral anatomy, atlas and axis, spinal and core muscles, lumbar stabilization, rib cage and sternum, and thoracic articulations. Section 4. Vertebral column, core muscles, rib cage, and thoracic articulations. Vertebral anatomy. The vertebral column serves as the central support structure of the body. It protects the spinal cord, provides attachment sites for muscles and ligaments, and allows movement of the trunk and neck. Although we often think of the spine as a single structure, it is actually composed of individual vertebrae stacked together to create both stability and flexibility. As you study vertebral anatomy, pay attention to the various projections, openings, and articulations that allow movement while protecting important neurological structures. Notice how the design of each vertebra reflects its function. Some structures serve as muscle attachment sites, while others create pathways for nerves to exit the spinal column. Understanding these landmarks is essential for both anatomical assessment and clinical application. Moving upward through the spine, let's examine two specialized vertebrae that allow much of our head movement. Atlas and axis. The first two cervical vertebrae are unique in both structure and function. Together, they support the skull and provide the majority of head movement. The atlas acts as a ring-like support for the head, while the axis serves as a pivot point that allows rotation. Because of this specialized arrangement, we are able to nod our heads in agreement and rotate them from side to side. As you study these vertebrae, consider how structure determines function. Their unusual shapes are directly related to the movements they allow. These vertebrae demonstrate one of the most important principles of kinesiology. Anatomy and movement are inseparable. Now that we've examined the bony structures of the spine, let's explore the muscles that move and stabilize it. Spinal and core muscles. The spine relies on a complex system of muscles for both movement and stability. Some muscles generate large movements of the trunk, while others provide subtle control and stabilization between individual vertebral segments. Together, these muscles help maintain posture, protect the spine, and distribute forces throughout the body. As you review these muscles, think about their role during everyday activities such as standing, bending, lifting, twisting, and walking. The spine is constantly responding to forces generated by movement and gravity. Without proper muscular support, those forces could place excessive stress on joints, discs, and ligaments. Several of these muscles form what is often referred to as the body's core. Let's take a closer look at that system. Core and lumbar stabilizers. The core is much more than the visible abdominal muscles. It consists of a coordinated system of deep and superficial muscles that work together to stabilize the spine and pelvis during movement. These muscles create internal pressure that helps support the trunk while reducing stress on the vertebral column. When functioning properly, the core acts like a natural support system that protects the spine during lifting, bending, and other daily activities. Research has shown that deep stabilizing muscles may become inhibited following episodes of back pain. This can contribute to ongoing dysfunction and recurrent injury if not properly addressed. As massage therapists, understanding these stabilizing systems helps explain many common low back complaints. Next, we'll examine where these muscles attach and how they contribute to spinal movement. Spine and core, attachments and angles. Every spinal and abdominal muscle contributes differently to movement and stability. Some muscles primarily generate motion, while others act as stabilizers that help maintain proper alignment during activity. As you study these attachments, think about how the direction of muscle fibers influences the movement they produce. Notice that different muscles often work together to create a single movement. Flexion, extension, rotation, and lateral flexion all require coordinated activity among multiple muscle groups. Understanding these relationships provides valuable insight into posture, movement patterns, and injury mechanisms. With the spinal support system reviewed, let's move outward to the structures that protect the organs of the thoracic cavity. Rib cage and sternum. The rib cage and sternum form a protective framework around the heart, lungs, and other vital organs. At the same time, these structures must remain flexible enough to allow breathing. The ribs, sternum, and thoracic vertebrae work together to create a balance between protection and mobility. As you study this region, focus on how the ribs are classified and how they connect to the sternum. Understanding these relationships helps explain how breathing occurs and why injuries in this region can affect respiratory function. Let's now apply these concepts to a clinical scenario. Clinical thinking, rib cage, and sternum. Imagine a client who experiences chest discomfort following a fall. As you evaluate this situation, think about the structures that may have absorbed the force of impact. Consider the classifications of ribs, the components of the sternum, and the role these structures play in protection and respiration. Think about which landmarks you could safely palpate and how breathing might be affected if movement of the rib cage becomes restricted. Clinical reasoning involves connecting anatomy with function and understanding how injury may alter normal movement patterns. To better understand rib movement, let's examine the joints that connect the ribs to the spine and sternum. How the ribs articulate. Breathing depends upon the coordinated movement of multiple joints throughout the thoracic cage. The ribs connect both posteriorly to the vertebral column and anteriorly to the sternum through costal cartilages. These articulations allow the rib cage to expand and contract during respiration. As you study these movements, visualize how the ribs lift, rotate, and expand during inhalation before returning to their resting position during exhalation. The mobility of these joints is essential for efficient breathing and overall thoracic function. Among these articulations, one particular joint is frequently emphasized in anatomy and kinesiology courses. Let's examine that joint more closely. The costovertebral joint. The costovertebral joint forms the connection between the ribs and the thoracic vertebrae. Although these joints are relatively small, they play a significant role in respiratory mechanics. Each rib must be able to move slightly during breathing while remaining securely attached to the spine. This balance between stability and mobility allows the thoracic cage to function efficiently. As you study these joints, think about how even minor restrictions in mobility could influence breathing patterns, posture, and overall thoracic movement. Understanding thoracic articulations completes our review of the axial skeleton. Next, we'll move into the pelvis and lower extremities, where stability, weight-bearing, and locomotion become the primary focus. This is the end of Section 4. The next section include pelvis, hip muscles, hip complex, knee anatomy, knee muscles, ankle and foot muscles, and lower leg osteology. Section 5, pelvis, hip, knee, ankle, and foot. The bony pelvis. The pelvis serves as the foundation of the lower body. It transfers body weight from the trunk to the lower extremities while providing stability and protection for important internal structures. Although we often refer to the hip bone as a single structure, It is actually formed by the fusion of three separate bones. Together, these bones create a strong, yet adaptable framework capable of supporting the body's weight during standing, walking, and sitting. As you study the pelvis, focus on the major landmarks and how they contribute to movement and weight bearing. Many muscles of the trunk and lower extremities attach to the pelvis, making it a critical link between the upper and lower body. Now, let's apply this anatomy to a common clinical situation. Clinical thinking, the pelvis. Imagine a client who reports discomfort after sitting for prolonged periods. As you evaluate this scenario, think about which pelvic structures support body weight during sitting and how pressure is distributed throughout the region. Consider the bones that form the pelvis and the socket that receives the femur. Think about which landmarks would be useful during palpation and how pelvic alignment may influence posture and movement. Understanding the pelvis helps explain many common complaints involving the low back, hips, and lower extremities. From the pelvis, let's move into muscles that power movement at the hip joint. Hip muscles and functions. The hip is one of the strongest and most stable joints in the body. Its muscles are responsible for generating powerful movements that allow us to stand, walk, climb stairs, run, and maintain balance. Some muscles act as powerful movers, while others function primarily as stabilizers. As you study these muscles, pay attention to how they influence movement in multiple planes. The hip must balance mobility with stability. It allows significant motion while supporting the weight of the body during nearly every functional activity. Because of this important role, proper hip function is essential for healthy movement throughout the entire lower extremity. Let's examine the hip joint and its functional muscle groups in greater detail. The hip complex. The hip is a ball and socket joint designed for both mobility and stability. Unlike the shoulder, which prioritizes movement, the hip must support substantial body weight while still allowing motion in multiple directions. The muscles surrounding the hip are often grouped according to the movements they produce. Some flex the hip, others extend it, while additional groups abduct, adduct, or rotate the thigh. As you study these functional groups, think about how they contribute to gait, posture, and athletic performance. Many lower extremity problems can be traced back to weakness, imbalance, or dysfunction within the hip musculature. Understanding these relationships helps explain why hip assessment is so important in clinical practice. Next, let's examine where these muscles attach and how they contribute to hip range of motion. Hip attachments and joint angles. Muscle attachments determine movement. By understanding where a muscle originates and inserts, you can predict the action it will produce when it contracts. As you review the hip muscles, focus on the direction of their pull and the movements they create. Notice that some muscles contribute to multiple actions depending on the position of the joint. Hip motion requires cooperation among many muscle groups. Flexors, extensors, abductors, adductors, and rotators all work together to maintain smooth and efficient movement. This coordinated activity becomes especially important during walking, running, and maintaining balance. From the hip, we'll continue down the lower extremity to the joint that connects the thigh to the leg, the knee. Knee muscles and functions. The knee is one of the most frequently used joints in the body. Every step we take requires the coordinated action of muscles crossing the knee. Some muscles extend the joint, others flex it, and several contribute to rotational control and stabilization. As you study these muscles, think about how they work together during activities such as walking, climbing stairs, squatting, and rising from chair. The knee depends heavily on muscular support because it experiences significant forces during daily movement. Understanding these muscles provides a foundation for understanding common knee injuries and movement dysfunctions. Let's now examine the attachments and actions of these important muscle groups. Knee, attachments, and joint angles. The muscles crossing the knee attach to structures in the pelvis, femur, tibia, fibula, and foot. Because some muscles cross multiple joints, their actions often extend beyond the knee itself. As you review these attachments, consider how the position of the hip or ankle may influence knee function. Notice that different muscles contribute to knee flexion, extension, and rotational control. These relationships are especially important when analyzing movement patterns and identifying compensations caused by weakness or injury. Now that we've examined the muscles surrounding the knee, let's take a closer look at the anatomy of the knee joint itself. The knee joint. The knee is the largest synovial joint in the body and plays a critical role in weight-bearing and locomotion. Although often described as a hinge joint, the knee also allows small amounts of rotation and gliding that contribute to normal movement. Because of the large forces transmitted through the knee, several ligaments work together to provide stability. As you study these structures, think about how they help maintain alignment while allowing motion. Understanding the relationship between bones, ligaments, and muscles is essential for recognizing common injury mechanisms. Now, let's apply that knowledge to a clinical scenario. Clinical thinking, the knee. Imagine a client who twists the knee while changing direction during a sporting activity. As you analyze this situation, consider which structures may be vulnerable during rotational movements. Think about the bones that form the knee joint, the ligaments that stabilize it, and the structures responsible for transmitting forces across the joint. Consider how instability, swelling, or pain may influence movement and function. Clinical assessment begins with a strong understanding of anatomy and biomechanics. With the knee reviewed, we'll continue downward to the ankle and foot. Ankle and foot muscles. The ankle and foot serve as the body's primary connection with the ground. These structures provide support, shock absorption, balance, and propulsion during movement. The muscles of the lower leg control movements of the ankle and foot while also helping maintain the arches. As you study these muscles, think about their role during walking, running, and standing. Every step requires precise coordination among multiple muscle groups to maintain stability while generating movement. Understanding these muscles is essential for recognizing common foot and ankle dysfunctions. Next, let's examine their attachments and contributions to movement. Ankle and foot attachments and angles. The muscles controlling the ankle and foot attach throughout the lower leg and foot. Their arrangement allows movement in multiple directions, including dorsiflexion, plantar flexion, inversion, and eversion. As you review these muscles, visualize how their line of pull influences movement. Notice how some muscles help stabilize the foot, while others generate powerful motion. These actions are particularly important during gait, balance, and athletic activity. A thorough understanding of ankle mechanics helps explain many common lower extremity injuries. Let's conclude our study of the lower extremity by examining the major bones and landmarks of the ankle and foot. Lower leg and foot bones. The lower leg contains two major bones that work together to support movement and stability. One serves as the primary weight-bearing structure, while the other contributes significantly to ankle stability. At the distal ends of these bones are important landmarks that can be easily identified through palpation. The foot itself contains numerous bones that distribute forces and provide support during standing and movement. Among these bones, one plays a particularly important role in weight-bearing and serves as the attachment site for a powerful tendon. Understanding these landmarks is essential for anatomical assessment and clinical practice. Now, let's apply this knowledge to a final lower extremity clinical scenario. Clinical thinking, lower leg and foot. Imagine a client who develops ankle pain after stepping awkwardly on uneven ground. As you think through this scenario, consider which bony landmarks form the ankle region and which structures may have been stressed during the injury. Think about how these landmarks contribute to stability, weight-bearing, and movement. Consider what you would palpate during an assessment and how anatomy can help explain the client's symptoms. Having completed our review of the lower extremity, we'll move into the final section of the study guide, covering the wrist, review material, and final exam preparation resources. This is the end of Section 5. The next section includes wrist anatomy, clinical thinking, the wrist quick review, cheat sheets, and final closing remarks. Section 6. Wrist, final review, cheat sheets, and conclusion. The carpal bones. The wrist is a remarkable structure that provides both mobility and stability for the hand. Unlike many joints that rely on a few large bones, the wrist is composed of multiple small bones arranged in a way that allows complex and precise movement. These bones work together to absorb forces, distribute loads, and position the hand for countless daily activities. As you study the carpal bones, focus on their arrangement and relationship to the forearm and hand. Understanding these structures is particularly important because wrist injuries are extremely common and can significantly affect function. Among the carpal bones, one is especially vulnerable following a fall onto an outstretched hand. Let's explore how this knowledge applies in a clinical setting. Clinical thinking, the wrist. Imagine a client who falls and instinctively reaches out with the hand to break the fall. Now the client reports wrist pain and difficulty using the hand. As you analyze this situation, think about the bones that form the wrist and the structures most likely to absorb the force of impact. Consider how wrist anatomy influences injury patterns and which landmarks would be useful during assessment. Think about how pain, swelling, and limited movement might affect daily activities. Clinical reasoning involves connecting anatomy to mechanism of injury and functional limitations. Having completed our regional review of the body, let's bring all of the major concepts together. Quick review. At this point, you have explored the major structures and movement systems of the body from head to toe. You have reviewed the skeletal system, important bone landmarks, ligaments, posture, muscle mechanics, joints, and major muscle groups. Remember that anatomy is not a collection of isolated facts. Every structure exists within a larger system. Bones provide the framework. Joints create movement. Ligaments provide stability. Muscles generate force. The nervous system coordinates it all. As you prepare for your examination, focus on understanding these relationships rather than memorizing individual details. The stronger your conceptual understanding, the easier it becomes to answer questions, perform assessments, and apply kinesiology in clinical practice. To support your review, the final slides provide quick reference tables that summarize many of the concepts discussed throughout this guide. Cheat sheet. Lower body and trunk. This reference table summarizes important muscles of the lower body and trunk. Use this chart to review origins, insertions, actions, ranges of motion, and palpation landmarks. As you study, try not to simply read the table. Instead, challenge yourself to visualize each muscle, locate its attachment sites, and predict the movement it produces. Ask yourself questions such as, where is this muscle located? What joint does it cross? What action occurs when it contracts? How would weakness or tightness affect movement? These questions will strengthen your understanding and improve long-term retention. As you continue reviewing, you'll see that the same principles apply throughout the body. Cheat sheet, hip and spine review. This section provides a condensed review of many of the important muscles involved in hip and spinal movement. Notice how multiple muscles often contribute to a single movement while also helping stabilize nearby structures. As you review these muscles, focus on functional relationships. Think about how the gluteal muscles influence posture and gait, how the hip flexors affect pelvic position, and how the core muscles support spinal stability. Understanding these relationships is often more valuable than memorizing isolated attachment points. The goal is to develop a mental picture of how the body moves as a coordinated system. Next, we'll complete our review with the muscles of the upper body and head. Cheat sheet, upper body and head review. This final reference table summarizes major muscles of the face, neck, shoulder, and upper extremity. Use this slide as a comprehensive review of attachments, actions, and palpation landmarks. As you prepare for the examination, challenge yourself to identify muscles based on function rather than memorization alone. If you know where a muscle attaches and the joint it crosses, you can often determine its action logically. Likewise, if you understand a movement, you can frequently predict which muscles are responsible. This type of reasoning is one of the most valuable skills you can develop in kinesiology. With our review complete, let's conclude the study guide. Now, it is time to have a quick review of everything you have covered. Congratulations on completing the INHE Human Kinesiology Study Guide. Throughout this presentation, you have explored the structures that create movement and the relationships that allow the body to function efficiently. You have reviewed bones, landmarks, joints, ligaments, muscles, posture, and movement mechanics from head to toe. As you continue preparing for your examination, focus on understanding rather than memorization. Ask yourself how structures relate to one another and how they contribute to movement, stability, and function. Remember that kinesiology is not simply a subject to study. It is a foundation for clinical observation, assessment, and treatment. The knowledge you gain here will continue to serve you throughout your massage therapy education and professional career. Take time to review the material, revisit areas that need reinforcement, and practice identifying structures through palpation and visualization. Thank you for participating in this study guide, and best wishes as you continue your studies and prepare for your examination.